term of Professor Salim Abdool Karim as co-chair of the Ministerial Advisory Committee on COVID-19 has ended. Karim was at the forefront of fighting COVID-19 in South Africa since he was appointed by Health Minister eNCA last year. He will now focus on his HIV research as well as other commitments. Professor Karim joins me now for this conversation. Prof, the department has called it a resignation. However, it's also been deemed as an end of term. So can you just give us clarity on which one is it? Have you resigned, or is it just your term coming to an end?
Yes, good evening, Faith, and good evening to all the viewers. In fulfilling the role of chair and co-chair of the Ministerial Advisory Committee, it is a voluntary activity. There's no contract, there's no employment, and so on. So it's not really a resignation. My term, when I had taken on this position on the 23rd of March last year, was I said, I'll take it on for a year, and then we'll see from there. And when my term came up, I felt, I have done my time, and I've now got to get back to all the things I've neglected. And so I decided that it's time to go back to my academic activities. And so I've stepped down. And I think that's the more appropriate term, given that I'm not resigning from anything in particular. And I've had no contract in that regard.
Yeah. I mean, the stepping down also, Prof, comes at a time where the country has to literally prepare itself for a surge, particularly during this Easter period that is coming up, if we do not necessarily adhere to protocols and the like. Would you say that this is quite a very intricate time in the South African context where we may need your leadership and guidance even more to avoid a third wave?
Yes, Faith. So, when you take on this kind of role, I had no idea what it involved when I took it on a year ago, but you really have to do this full time. This is not a part-time thing you do in your spare time. It is all-consuming. You have to spend 24/7. That means you have to put everything else aside. And I can't afford to do that anymore because I've got critical research activities I've got to get back to. And so I'm continuing my COVID-19 activities, just in a lower priority. HIV now will take first space, COVID takes second. If we look at where we are, this is the best time, actually, for me to step down. We have a strong Ministerial Advisory Committee, excellent scientists. We've produced, superb, scientifically, carefully crafted advisories. And as far as the epidemic is concerned, we are now in a very strong position of low transmission. We have, around 1,000 cases per day. That is a pretty good place to be in. Now, we're not in a third wave. We don't have any trends that look like we're going into a third wave. What we have to be careful of is that we don't end up with Easter and some of the activities there that it might undo our current strong position. And so when we've provided advice, it's been rather focused on let's try and maintain our good position. Let's not do anything that might ignite a third wave. So now is a pretty good position and a good time to resign.
Yeah. I mean, let's talk a little bit about that and staying on the theme around, having the right advice around, because oftentimes government and the Department of Health has been criticized for the lack of transparency where the dissemination of information is concerned, particularly on the rollout program of the vaccine. Now, if you take us into your confidence a little bit, when you view it from an advisory perspective, how has government handled this position where it's on critical, sensitive information, but also on the public that need to be given the adequate information to make the right decisions for themselves?
So I've been involved in many epidemics and pandemics, and HIV, TB. I've been involved in investigating measles epidemics. I've been involved at a global level in many other things as well. I have never seen a situation where the government and the minister releases a press statement every day providing us with detailed numbers of cases and deaths and so on. That's just unheard of. This is setting a whole new tone of communication and proactive communication. In particular, South Africa is quite unique in one respect. I know of very few other countries where you have scientists going onto national television to explain complicated scientific concepts to the lay public, that's a very powerful thing to do. And the fact that, having dealt with HIV and so on in the past, that the first steps that the government undertook, and particularly the Minister of Health undertook, was to call the scientists together. The scientists didn't go to the minister and say, we'd like to give you advice. He called the scientists together. And at that first meeting where we were about 50 or 60 scientists, that we came together to provide advice that he wanted. So I found is a situation where the government was looking for advice. There was the thirst, and science got a center stage like never before. Normally, I'm used to being a backroom person. But in this case, we were front and center because of the importance of science. And I think that is an indication for me of what's to come in the future. We will now be in a much better position to deal with the next pandemics.
Yeah. I mean, can we also do better, Prof, in the way in which we're sharing this information with the public, so we do not have the likes of healthcare professionals still worried about or concerned about the vaccine, because the very same healthcare professionals, we're on phase 1 now, as we move into the other phases, are the ones that have to be explaining this rollout program, including the vaccine, to the general public, to you and I, who have to feel, comfortable around taking it.
Yeah, and I think I've seen a situation where there are areas of communication that we need to do a lot better in. I've seen that, for example, in dealing with hydroxychloroquine. There was a need for more information. There was a need for more information on the Madagascar and artemisinin. And I see that now on the vaccine front, where people want more information. There's a thirst for information like I've never seen before. I mean, the issue of a vaccine rollout is a matter that, planners and people doing operational work will try and work out. But the public has a different level of expectation now. And I think government has to learn to try and meet that expectation in a more proactive way. And I think that's a very positive thing. It's a signal of the strength of our democracy and the fact that we want to be empowered. We want, each of us, we want to know what's going on. And I think that's for me, again, setting us on a good stage for how to think about this epidemic as we go forward and how to prepare for the next epidemics.
Well, Prof, you're mentioning the real critical issue here, because we've also seen this publication on the new SARS-CoV-2 variants, the clinical public health and vaccine implications as well. I know that we've been working with other scientists, for example, such as Professor Tulio de Oliveira on it. Take us into your confidence. We know that there are multiple variants of COVID-19 across the globe. Are we seeing potentially a new variant in the South African context?
So, the article that just appeared late last night in the New England Journal of Medicine captured, the 4 key issues that we have to very carefully think about when we think of variants. The first, is it more transmissible? And we provide the evidence that shows that the South African context, we've seen the virus spread at a much faster rate. How fast? About 50% faster. In the UK, the B117 variant has spread about 40 to 70% faster. So these variants are spreading faster. That means your hospital beds get filled more quickly, you need more oxygen quickly, and so on. The second is, are they causing more severe disease? In the UK, the B117 variant, it certainly looks like it's causing extra deaths. In South Africa, the most recent analysis from the National Institute of Communicable Diseases, Dr. Wasila Jassat, shows that we're seeing about a 20% higher death rate. The third, is it causing reinfection? Are those who've had previous infection, are they now at risk? And the answer is yes. The new variants are causing reinfection. The past infection is providing some protection, but not adequately. And finally, we're seeing how variants are compromising vaccine immunity. We're seeing how vaccine efficacy is lower in the context of variants. In South Africa, we are already starting to see the emergence of other variants. Now, variants occur all the time. What are we worried about? Are we going to see a variant that changes in the receptor binding domain, in that part of the virus that attaches to the human cell. Right now, thankfully, that is not apparent. But we continue to be vigilant. We continue to monitor the genomics. And if we see something that's indicating we have a new variant, then we know we need to be really careful, because we cannot predict what is going to happen with the new variants.
Prof, we'll have to leave it there for this evening. Thanks a lot for joining us and shedding some light in terms of what's going to be happening in the future if we adhere to COVID-19 protocols, social distancing and the like. Professor Salim Abdool Karim stepping down there as co-chair of the Ministerial Advisory Committee. To the story now.